Hey guys, hanging out in the procedure room. Just want to show you what it looks like. Getting ready to take off my makeup so that she can do my Botox. Just waiting for the nurse to come in and we can get started with some information for you guys. Just hanging out, waiting for my appointment to start. Have to take the makeup off the top of my head everywhere where she plans to inject. So in the crow's feet area here, obviously my forehead and between my brows, crow's feet on other side. So she has to have a clean working surface, very obviously. I'm not gonna lie, there's some things in here that I wouldn't mind playing with while nobody else is around. For instance, that's VelaShape. VelaShape for cellulite and making fat cells smaller. Sign me up. All right, I have a nurse in here. This is Tori. Tori has been doing my Botox for, what do you think?
I don't know, several years.
Several years now. And I lied to you in the car. I actually am due right now. So it's almost 3 months from the day that I last had my Botox done. So I've gone longer than that.
You have, probably not on purpose.
Never on purpose. If I could be liquid glass.
Yes.
That's the look I'm going for. No lines whatsoever.
I can do that.
So one of the big reasons that I like coming to Tori, and I was doing Botox long before Tori, and I had no idea that they actually can get some brow lift when they do your Botox. I actually was having the opposite, where I would get Botox in my forehead and then my brows would just slowly drop over the next 10 days. And you couldn't even see my eyeshadow or anything because my brow dropped so low. So I thought that was a part of Botox, and it was a give and take or a trade-off for no wrinkles on my forehead, but no palette to put my eyeshadow on. But Tori is a wizard. And she is the reason that my brows stay high and actually lift even higher over the next few days after I have this Botox done. So right now she's just getting everything ready. She's being very gracious to let us record today.
It's my pleasure.
What else you guys do here?
Filler, Botox, Kybella in terms of injectables. And then laser, all the regulars, laser hair removal, IPL photofacial, vampire facial.
What's a vampire facial?
So it's microneedling, but the vampire part comes from, we draw the patient's blood ahead of time and spin it down in the centrifuge so that the red and white cells fall to the bottom, and the platelet-rich plasma, or PRP, is at the top, and we draw that off and we put it onto the face when we needle, and it kind of pushes it in and injects it, and we put it on after as well, because these are intentional but still micro injuries, and the face is very receptive to anything that we put on there. So the plasma it's patient's own, so nobody, well, not nobody,
no negative reactions.
There's not a lot of reactions. Usually it would be from the numbing cream, not from the PRP. And then it heals nice, it's faster, there's a glow, it makes the collagen production and synthesis of elastin. It all inhibits all of that.
Do you do it?
To myself, that's one thing. I've had the needling part, but never with, I can't draw my own blood. And I do all of my own stuff because I'm the only one here. So one of these, that and Kybella, and thread lifting. Those are the three things I have not done on myself. Everything else, yes, religiously.
Your skin looks really good. That's why I was asking.
Thank you.
When you guys do the micro needling with that, so I use the little roller, and one of the things they talk about with the roller is as it rolls, sometimes it doesn't give you that direct in and direct out needling. What type of head do you guys have? Is it a roller type thing, or is it the?
I have that, but I don't like to use that. I have a platform that has my laser and IPL. It's in the corner there, and it has an RF microneedling application. So it's bipolar radio frequency, and it ablates the skin, so it resurfaces very well. There is some downtime. It's a little uncomfortable. I use numbing cream for those patients. But if they're willing to deal with the downtime and not skeeved out by having their own serum, blood, it kind of looks like serum. It doesn't look like blood anymore.
Better than somebody else's.
Well, that is certainly true.
What's the downtime when you say if you don't mind the downtime?
So when they do the plasma, it's not as bad. Usually they're back to work the next day, but if you get very close to somebody, you can see these pinpoint little scabs, and then in 3-4 days they will slough off, but in the meantime you can't hide them. They're darker and they look like little tiny pinpoint scabs, and not everybody gets them. It depends on the amount of radiofrequency used. Some people can't handle the higher numbers, but those people will have multiple sessions, whereas somebody who can tolerate some of the higher settings might get away with just one and then be finished.
Did you ever have, back in the day, do you remember before hair removal lasers were a big deal, do you remember when they did the radio frequency into each hair follicle?
What is that called?
I can't think of what it's called. Electrical.
There's there's a name for it. I have patients who will have stubborn hair.
Electrolysis.
Yes, thank you.
So
that is it.
I'm wondering if it's a similar feeling, because that's a radio frequency type thing where that goes.
I've never had electrolysis, but it is not an electric feeling. It is a burning sensation. Okay. And then the rest of the night, you feel like you've got the worst sunburn of your life.
Huh.
And in fact, so much so that I sit in front of a fan. It could be January and I've got the air conditioner on the way home when I do that. So I do it without the vampire part, but it is very, very hot.
Huh. I think that's something I might look at trying.
Well, it is certainly, it gets rid of the fine lines and wrinkles. It gets rid of even some of the superficial age spots. It's not going to do, what Botox does with the deeper dynamic wrinkles. But the superficial ones that we have over our face, as well as decreasing the size of the pores, and
that's
people just have a
question everybody asks about.
Because our pores get bigger as we age. You look at a child and you don't see a single pore on their face, but
the baby's bottom kind of face.
Yeah. So the biggest offender of that is, and surprisingly, some people are surprised to find out, is sleeping in your makeup.
Yeah.
You cannot do that.
It keeps everything blown open.
Yeah.
Yep.
It's nice to kind of, I think everybody thinks it's a pain in the butt to wash off your makeup at night. I always end up with water down my, everywhere, but you got to take it off.
Everybody that asks me about solution for pores, the first thing I say is clean your pores.
Clean your pores, right.
Spend some time.
Not overdoing it either,
right.
Because you need some of that sebum.
Spend some time making sure the answer isn't to fill them with makeup and primers, it's to get them to close a little on their own so you have a better surface.
And then the makeup and primers, that's helpful.
Yeah.
So did you remove, speaking of makeup,
I did remove my forehead makeup.
That's fine. You don't need to take anything else off. I do use alcohol preps, obviously, to clean the skin, but the makeup doesn't often, especially the long wear ones, don't really break down well with just alcohol. So that's why I have you guys wiped.
Oh, we were locked in here.
If you don't mind, I would like to, I probably don't need to take pictures today. We can maybe use pictures from this.
All right.
If you need a touch up, which you've never needed. So I'm going to clean the skin and I'm going to mark you. So put the dots exactly where I want to do. Some people don't mark, some do. My husband, and I'm sure people that know me well, will think that I'm a little anal retentive, but I like to say it's meticulous, which is what you should be with someone's face. I'm going to wipe off here by the eyes.
That's fine.
I'm trying to preserve your wing.
Can't mess up my wing.
I'm jealous. I can't do the wing.
You can do it. Did you see my tutorial?
I did actually see it. And I have tried since then to do it.
Can't do it.
I was getting in the shower the other night, and that's my favorite time to practice makeup because it can look awful, and I'm getting in the shower.
Wipe it off.
But yeah, no, I have one up here, one out here, wipe it off, one here, one here. They're all over the place.
I'll show you a trick before we go.
Okay.
But essentially, if you put this finger here at your ear, and this one at what I would consider the corner of my face, and then this one directly in between, that's what you're aiming for.
Oh.
Do it on both sides, and then you can just kind of visually...
Yeah, so I've tried everything. I've tried putting a piece of tape there, and
tape works really good.
Yeah, no, you have to get the tape on straight, which is something that is I find difficult apparently.
So you're just meticulous with everybody else's face.
I think it's nice. I'm meticulous in general, except for with cleaning my house.
Me too.
All right, so look right here in the middle. I want to see your mid-pupillary lines. Okay, and then scrunch them down for me. Good. So we have 3 muscles in this region that we're trying to hit, which is why this eats up the bulk of the doses, of your Botox. Raise like you're surprised. We're going to do a normal dose here and here and here in this V-shaped pattern. So it makes everything in the middle still, and then we do less out here so that you still have this natural arch in the right spot to lift the brows.
That's what makes you the Botox Jedi Master.
I think everybody probably knows how to do this, right?
You're the first one I've paid to have do it.
Oh. Well, then I'm a special unicorn, I guess.
Isn't that the truth?
All right, so my pencil is coming off onto your skin. Okay, there we go. And then just close your eyes. I'm going to feel the edge of your ocular vein. Smile for me. Let me see where you... Okay, good. And then bite down on your back teeth. And then
it's an interesting thing.
Yeah, so there's this natural suture fusion in the skull here, and it's the difference of the temporalis muscle and the frontalis muscle. When you bite down, you can feel it flexes, and that is usually right along there is where you're going to put this lateral injection in the brow, or the injection in the lateral portion of the brow. And you can also kind of have them pinch down, and you pinch it there. That gives you an idea of how much you can lift someone, but we know that you get a great lift. So.
Yeah.
Okay, bite down. Turn your head up just a little bit, and then relax. Yeah. And then let's just see here. This one probably needs to go up a little bit. Smile. Do you sleep on this side of your face?
Yes.
Yes.
You always call out the right side.
Well, it's micro. I mean, it's very small.
Yeah.
Difference. But that's what I'm looking with the eye of somebody who's looking for that. It's not like it's noticeable as you walk down the street.
It's okay. I try to sleep on my back a lot more than I used to anyway. Mostly
we got a new
because
mattress, and I am sleeping on my back finally. But normally
Really?
I'm a side sleeper. Mm-hmm. But it's kind of hard. My husband likes a harder mattress, and I like a softer one. So.
my weighted blanket has now made me be able to sleep pretty much everywhere.
Yeah, I heard those are really
Insane.
good. Okay, I'm going to lay you flat. No back problems or any reason why you can't be flattened out?
Nope.
Okay, and then if I can have you scooch just up a little bit to me. Perfect. So, have you taken any ibuprofen or blood thinners like aspirin in the last 48 hours?
No.
Okay. And do you bruise? We don't usually see
I never
bruising.
have gotten bruises
Never
from them.
bruised. Very, very good. Okay, put your head down a touch. So, I have to just double check here.
It's kind of funny. I'm looking forward to watching this footage back, mostly because I've never seen a needle go into my own face before.
Oh, okay. Well, if you feel at all like you're gonna pass or pass out, or like drop the camera onto your face,
like that,
give me a warning so that I can move the needle out of the way. Perhaps maybe catch it for you.
I won't drop it.
Okay, scrunch down for me there. Good, and then relax. I'm just gonna pinch the skin. 1, 2, 3. So, in terms of aftercare, no heavy lifting, no strenuous exercise today. No stick.
So everybody knows you can barely feel. It's the tiniest needle.
It is I think it's actually smaller than an insulin needle. The insulin needle is a 30 gauge, I believe, and these are 31.
And the Botox itself has no sting or anything.
Right, no,
as
it's very different than the Kybella or the Juvederm. Want a stick?
So I'm sorry, we interrupted you. Back to the aftercare.
Yeah, so we just recommend not to touch your face. But if you wash your face tonight, or if you have to touch it, it's gentle and it's always away from the eye.
Okay.
So you don't want to drag any of that Botox underneath of this brow here, where you have these muscles that lift and close your, lift and close your eyelid, and that's what we call ptosis. And
okay.
We don't want to see that. So this spot here bled a little bit more. I'm just going to put some pressure on it while I go over here. A little stick. 1, 2, 3.
And no exercising tonight.
Nope.
I think I can survive.
I think, yeah. So, I mean, it's always a welcome, get a break from exercise.
Oh, yeah. We had
Would you like me to write a note about dinner, like no cooking and
Could
laundry?
you? Yes. No cooking, no laundry. Yeah. We had a just conversation the other night on the page. It was about dry shampoo and how often do you wash your hair, that whole deal. And I realized after close to 200 comments and everybody's sharing what they do, that the answer is don't exercise. Well, the longer you don't exercise, you don't have to wash your hair.
All along. That is not news to me, but I'm just lazy. That's why I don't exercise.
Yeah, I don't exercise.
I mean, I have a gym membership, but it's because they have a really nice pool, and it's cheaper than the neighborhood pool membership.
Really?
Yeah. Raise like you're surprised, and then relax. You still have a little bit of toxin here in your upper face.
Yeah, I'm surprised it's only been 3 months.
Right. I thought it had been, actually thought it was sooner, but then you didn't have it in October when...
At the party.
At the party, right. Yes, at the party.
Late party.
So again, if you need a touch-up, which is something that you've never needed, but that should be in no less than 2 weeks.
Okay.
Raise like you're surprised. Good, and then relax.
And generally it takes up to 10 days to see the full effect.
Raise again.
Or 2 weeks. Is it 2
so
weeks?
They say it could take up to 2 weeks, but most people will see some changes in the first couple of days.
Yeah.
Except for me, which is totally unfair. But
you go to full 2 weeks?
2 weeks.
Really?
Yeah, I'm like ready to touch up with the syringe in my hand, and then I wake up on the 14th day, and it's like, oh, okay.
By the 4th or 5th day, I'm close to full effect.
So I have a theory that do you exercise your facial muscles after
I do it
treatment?
a lot.
I forget to do that all the time, and I think that actually does really help a lot. So I'm going to be
I thought it was a very, very strict direction or instruction for post-op, so I absolutely do it.
Yes, turn your head to the side for me. So this is a really vascular area. You can see you've got, if you can make that vein kind of pop out there.
Happens when I get angry too.
I know. I've got the same one. Turn your head just so I want to get a look at it in the light. Okay, little stick. 1, 2, 3. You'll have these little lumps called blebs mostly everywhere that I put the needle, unless I've had to put like extra pressure on it. Little stick. I'm going to pinch it off of the vein. Hopefully you don't get totally missed the vein there. That's great.
Thank you.
That's a positive thing. We are not drawing blood, so we want to make sure that we don't hit the veins with cosmetic injectable. Okay. So I usually have the patient just kind of put their hand over that. Do you have an extra? Okay. Just flat over all 3. Because when you turn it's not bleeding, but when you turn the other way, I don't want it to start bleeding. And then we'll just do the same thing on this side. I'll have you turn to your right now. Got that same vein there. Smile for me. You can see the lines. Okay, and then relax.
I'm so glad that I did my crow's feet before my son's wedding. That's the first time I ever did it.
The crow's feet, I think, makes more of a difference sometimes in some people than anything else with Botox, because it is just so good. But for some reason, I don't know if it's a provider thing or if it's why it happens, but people shy away from the eye, or they put it way out here, or they underdose because it's a vascular area. It's riskier, and for that reason, people never they go, oh, it just doesn't work on my eyes, but they just were inappropriately dosed potentially.
To me, it was in a picture, in a still shot.
Yeah.
It is what made the most difference as far as a youthful look.
It makes it, I know. And I'm going to touch mine up too, because again, I'm noticing I have these wrinkles that go all the way down past that point. So I also use filler for that. But I think they should be better right here. So, and I'm about 3 weeks out now, 3-4 weeks out. So I'm ready for my touch up. I have it in the fridge at home. Waiting for the kids to leave me alone long enough.
So you can see it almost looks like, I wouldn't say a bee sting. It's not raised that much, but a tiny little.
And redness is from the rubbing that I did, but and the medication will smooth. It'll be gone by the time you get to 270. But right. Exercising will spread that, or not exercising your body, but exercising the muscles will spread out the Botox, but only in the muscle that it's intended, right? As opposed to rubbing it, which is sometimes what I fear people will do when they see the lumps in the car.
Everywhere else.
Yeah. We don't want that. So just up, down,
just do
invert,
this kind
squint.
of thing.
Yep.
Up,
and it'll spread, not continuously, but a couple of reps of that every few minutes for the next half hour.
Okay.
Great.
Well, I appreciate it.
Oh,
Thank you
you are
so
quite
much.
welcome.
I'm going to put your website and everything down below
Awesome.
because I have a lot of people that are local that I'm pretty sure would be interested in the brow lift piece of it, if nothing
Fantastic.
else. So on that link, you'll see all of the services that they offer here at Renew You. We're in Rockville. But thank you, Tori.
You are welcome.
I
Always a
appreciate
pleasure
it.
with you. Thank you for your
All right.
patience. I
Thank
made Brooke
you.
wait a little bit today.
She always makes me
Again,
wait
for the
because
second time in a row.
I'm nice enough to wait because she's amazing. So, all right, you guys, I'll talk to you later.